What I want to talk about is some of the ways in which we can start to think about digital health technologies, and the objective of what I say is to actually offer something which is quite optimistic, I think, in terms of a perspective on this, because I think sometimes we want to be ultra critical and say this is terrible. You know, what's happening at the moment is a real problem, and we're concerned about the consequences of some of these technologies and what it's doing to people. It has all sorts of unintended consequences which are now going to pan out for people who are around today, who are in their teens. They're having some quite problematic experiences as a consequence of that. So I'm going to suggest, well, maybe we can be rather more optimistic about that. So I shall go through some of the micropolitical consequences of technologies, but what I'm going to say is that we can start to re-engineer some of these technologies, and that this opens up some possibilities for the digital generation, which is got 60, 70 years ahead of them now. Quite unimaginable, really. Let's just think about, one of the things I was struck by in the opening session was the idea of trying to future-proof this project. I don't think you can future-proof it, because I think we have no idea what technologies can do. Just think about mobile phones. It's the obvious example, isn't it? I remember in about 1986 going to a car auction, and I actually managed to buy myself a nice car of that for about 200 quid. But there was a guy there who was a dealer, and he had a phone, and I thought, wow, that's really cool. This is a long time ago. But that phone, the thing he held up to his head was like an old-fashioned phone with an earpiece and a mouthpiece. And then under his other arm, he had something about the size of an electric toaster, but actually weighing a lot more than an electric toaster, something which was like a couple of bricks, which was presumably the transmitter and the batteries. And that was all pre-cell phone, so it's a completely different technology. We had no idea about how we will use our phones today in 2017, and we had no idea of what technology is going to be like in 30, 40, 50 years' time. So I think there's actually, you're not going to be able to future-proof this project, but what we can do is we can actually be open to the way that we can continually analyse the data which we've about the world and actually start to use that. Let's start off, and I wish on this slide I actually had one of those things where you could hide a bit at the beginning and then it would pop up, because this is one of those slides where effectively what I say is there are three ways to analyse technology, and I list them there. And the first of these is technological determinism, which is to do with the concept that technologies somehow establish particular social interactions and relations, and that's obviously very apropos to the kind of pessimistic perspective. The second one of these that has emerged out of sociology and technology, sociology of technology and science, is a social shaping perspective, which says that we can understand technologies as not determined, but things which actually shape themselves by social, economic, scientific forces, and will lead us to society to achieve specific social and cultural objectives. And then the third one, which has come out, is the idea of technology as an affordance, which really suggesting that technologies have been designed in order to achieve specific things, for example, to further the interests of a neoliberal agenda, or to further the interests of patriarchy or whatever. However, I'm actually going to explore technology from a materialist perspective, and that's the lens which I suggest to you will be useful for actually thinking about digital health. So the objective of a materialist ontology is to avoid both social essentialism, which is the idea that technologies are shaped by society, and the technological essentialism of actually suggesting that technologies determine do. Let's look instead at the material capacities of digital technologies in specific contexts. And that allows us to ask a couple of interesting questions. Firstly, it allows us to look at the body interactions, if you like, the cyborg, which is produced by body technology interactions, and ask that question: what can a digital technology actually do? Which is not about what it's meant to do, but it's about actually what it does in practice. But then another much more interesting question, in my view, is what might digital technologies do? The materialist ontology, which I'm going to suggest to you, is this is all the theory, basically. It's just all on this slide. It's about thinking about relations between technologies and places and other physicalities, rather than thinking about entities as pre-existing. It's thinking not about what my attributes, the essential attributes of myself, but actually recognizing that my capacities and your capacities actually emerge within particular contexts. It thinks not about the idea of agency, of us as human beings, as self-determining, free beings, but actually recognizing that in certain contexts we have capacities to affect and to be affected. Instead of thinking about systems or structures which are determining what we do, we actually recognize that instead there are fluctuating assemblages, which, just call them contexts if you like, of the interactions between a body, a technology, a place. We can think about it right now, what's happening at this moment in time, the interaction between me, you, this weird lecture theatre format, the PowerPoint presentation, which actually has pushed me into a really linear presentation. So let's recognise that what we have here is a fluctuating context or assemblage. That has consequences because we have to stop thinking about the politics of social forces and power and resistance as something which is bearing down on us, but instead think about the micropolitics of what is going on in an event. And let's move away from thinking about discourses and texts, the ways that capitalism has guided us over the last 30 years. Very helpfully, let's actually start thinking about materialities instead. So, I'm a sociologist. My concern is not with philosophy, it's actually with making a difference in the world, understanding what's going on, suggesting how we might actually change things for the better. So, what I do is I use that ontology, which I've just talked to you about, to try and understand what is actually going on in the world. I want to look at digital technologies within the particular sense within which they're constituted. I want to ask what capacities do these technologies produce in bodies or in organisations. I want to ask questions about the micropolitical impact of technology and how it affects things like social order, continuity and change. And then I also want to ask this last question: how might we actually change those micropolitics? What might we actually do to the interactions between bodies and technologies, about altering their context within which they're being, within which they're assembling, within which they're interacting? So let's get down to something more substantive now, and let's actually think about the topic of digital health technologies. So I've referenced at the bottom to a paper which actually finally emerged in paper earlier this year. It was around online for a couple of years previously in the journal Health. And I have talked about there about personal health technologies, digital health technologies, things that are for use by an individual, typically outside of a formal healthcare organisation. There are things which may involve self-tracking or monitoring of body functions or performances. And these are either for self-care functions or potentially with some interaction with formal medicine. Some of these may actually have therapeutic intervention functions as well, and in the paper I talk about that. I'm not going to talk about that today. And typically, the new generation of these technologies are using communication network functionality, and that is why the concept of a digital health technology has emerged, and that appears to be our favoured phrase to explain these, to describe these. So what I'm going to do is to reverse engineer some digital health technologies to ask a number of questions. And I've just listed what those questions are here. I'm not going to read those all out. You can look at those. Incidentally, if you see the little Twitter line there, if you want to tweet about this, if you include that, I'll retweet it later on with the Sopni Mat, which is my Twitter feed. So I'm going to analyse 3 digital health technologies in a moment, and I'm going to ask what are the relations, how do those relations interact, what is the micropolitics which emerges for this particular technology when it's being used, and what capacities does it produce. So those are my 4 questions. So the first of these that I want to analyse is the classic tracking device that, if you don't use one yourself, I don't use one myself, but I think we're probably all familiar with this kind of tracking device that is there to enable us to provide some quantified data on pulse, posture, movement, how many hours we sleep, health indices, but also things which might encourage us into action. And then what I've done is I've listed what I would call the bit or the tracking device assemblage. And that's just a list of some of the relations which might be involved. There's actually more than that, but that will keep us going. And these are the interactions of the different human and non-human materialities. And what does this do? How can we analyse this? Micropolitically, we can understand that it does a number of things. It helps to quantify body performance in daily life. It encourages behaviours. It responsibilises users around health and fitness. It creates routines. This is the assemblage, not the technology. It creates competitiveness with self and others potentially, and we've heard about that earlier on in relationship to the Mathletics app, and also potentially commercialises fitness. So let's look at a couple of perhaps less familiar apps or technologies. The first one I want to talk about is one called Fetal Beats, and the purpose of this is to enable people during pregnancy to actually get a sense of what their fetus is doing inside the womb, to actually measure heart rate. It links that into a smartphone or whatever, and also allows you to share that data potentially with your friends or maybe with your physician. So we can see here again, we've got an assemblage which I've set out, which includes things like the fetus itself, and then some of the technology that enables that to connect. It also then connects to the parent. So what is the micropolitics of this? It actually allows a parent to monitor in real time what the fetus is doing. But at the same time, what it does is it responsibilises the mother in a positive and healthy fetal environment. For example, it may well be that the fetus's heart rate will suddenly rise, and poor mum is going to think, well, what am I doing? Why is my fetus suddenly getting stressed out inside me? Perhaps I should change my behaviour. Perhaps I should, stop eating the burger and chips which I've just been putting away and eat something different. So we can see here a micropolitics which is actually moving beyond simply what the app is designed to do. And then the third one I want to talk about is one called Visa, which is a coaching app. And what that's there to do is, I could click on the link and show you it, but I don't have enough time to do that, so I'm not going to do that. What this is a virtual coaching app which allows people to share with some in-house online health and fitness coaches who interact with the person who's the client of Visa to promote a health and fitness program. You can actually choose a number of different coaching styles. What is the assemblage? Well, I've listed some of the things here, and perhaps more interest here is thinking about the micropolitics of this, which is putting a body into a much wider assemblage, which turns health and fitness into the way to make money for the app. It also outsources to the app some of the traditional tasks of the healthcare system to sustain health and illness. What this tells us, these examples tell us, is that we have to try to understand things in terms of the assemblage, not the technology. We need to understand the emergent micropolitics of these technologies, and we need to think of these in terms of the wider social processes. So I just want to move on to talk about digital capitalism for a moment, in 1 minute, and my last minute will then be about talking about the alternatives to this. What we can see with many of these health technologies is how they engage within a capitalist framework. And the main features of digital capitalism have been identified by scholars, and I've listed those there. Actually monetising services, marketising health, turning health into a consumer product, and privatising and outsourcing. And we can see that with Visa, that it actually does precisely that. It reduces the cost of providing coaching. This is the equivalent of, this is the health equivalent, sort of a taxi company or whatever. It brings coaches and consumers together online. It establishes a global market. It produces virtual versions of existing businesses. So just like Uber has taken the business model of a taxi company and put it online, and then finally it reduces margins. So I'm going to skip forward now and just say that what I've done is I've reverse engineered these technologies, but what we can do also is we can forward engineer technologies to produce different micro-political outcomes. And what I'd like to suggest is that we can actually start to think about how we might use digital health technologies to subvert rather than to support biomedical or corporate interests. We might reject individualized approaches to health. We might reject a monetisation of health and fitness, and we might actually connect people together and enable them to do different things. And I've called this in the paper citizen health. It's actually opening up new possibilities. So it's actually saying, well, let's not accept that technologies have to be the way that they are actually set up. So my conclusions are these, that we can use the kind of approach that I've suggested here to ask some key questions. We can ask what a digital health technology can do. We can analyse its micropolitics and how it contributes to digital capitalism. But, and this I think is really important, and I hope will be a theme which will continue to reverberate today, is we can actually also re-engineer some of these digital health technologies to do different things, to actually challenge some of the structures and the processes and the policies of the world that we are living in today. Thank you very much.